Tough story to hear. We're joined now by Dr. David Perry from Pediatric Healthcare. It's hard to listen to parents who have lost a child. What exactly is RSV, and are you seeing a lot of cases right now?
So RSV, for most people, is a bad cold virus. So most older children, teenagers, adults, healthy adults, get a cold. It seems like a maybe severe or a bad cold, maybe bronchitis happens. But in small children under 3 years of age, they can get very sick, especially babies under 6 months of age and children with special medical problems like a heart condition or childhood cancer.
The parents we just heard from in the story did not keep people from holding their children. Should we set boundaries? Are those important to protecting our babies?
It is actually very important to try to maintain those boundaries. First 3 months are critical. If it's possible to keep your baby kind of sheltered and bubbled during the first 3 months of life, it would be very beneficial. Even teaching the siblings want to touch their new baby brother or baby sister. They want to kiss on the baby. If you can teach them to touch, kiss the feet, that would be a safe thing to do. And then don't take the baby out into large crowds and try to avoid places where you think that there might be people with a cold or a sickness.
You mentioned siblings, and siblings often bring a lot of germs home from school or daycare. How do we protect them from the germs that are coming into their own home?
Protect the babies from?
Yes.
So you can't help it when your school-age child goes to school, they bring something home. But then you can teach them about how to wash their hands and how, if they sneeze, to do it away from their baby brother or baby sister, and to use general good hygiene.
Yeah, don't get in their faces.
Right, don't get in their face.
They love to get in their faces
they
and
do.
talk to their babies. What symptoms should parents be concerned about with RSV?
So first, RSV starts out just like a cold. The baby might have a runny nose, stuffy nose, not eat well. And then in a day or two, they start to cough. And the cough can become severe, and the baby doesn't want to eat well. And so there's kind of two main things you can watch for at home. One is how fast the baby's breathing. So it's nice to maybe, if you're worried, take the baby's shirt off. Look at the stomach. You can count in and out movements of the stomach as how fast the baby's breathing. And you can also see if the baby's really having trouble breathing, you can see the ribs on the side of the baby's chest get sucked in, and then you know you need to contact your doctor.
And when should you go to the pediatrician? When should you go to the ER?
If you count in 60 seconds and the baby's breathing over about 40 times a minute, you should get seen by your doctor. If they're doing it over 50 to 60, you probably should go to the ER. And if your baby's not eating well and you're worried about the baby being dehydrated, that's a time to contact your doctor.
How much should we pay attention to that mommy instinct?
Always trust the mommy gut. That is, I've learned over the years that if a mom thinks her baby's sick, you need to pay attention.
Yeah, some children don't run high fevers when they're very sick. Others can be very, very sick and not have much of a fever at all. So that mommy instinct sometimes will tell you, hey, I need to go see the doctor. Between RSV, flu, and COVID, and all these other illnesses that are going around, what should we do as an entire family to protect our health?
Well, we can, always wash our hands and try to if we're ill, try not to get in people's faces. As far as RSV goes, there are 2 new products out there that can be utilized. One is for pregnant women. So if you're pregnant, you should talk to your OB doctor about should you get this vaccine. And another is a shot for newborn babies. And we're excited that this is out now to protect the smallest babies. So talk to your pediatrician about that.
Thank you so much for joining us. Some great advice. We appreciate it.
You're welcome.